guys, today is a video that I've had quite a lot of popular demand for in follow-up to some of my other personality disorder videos. And this personality disorder is one of the more commonly diagnosed personality disorders. It also kind of comes with a bit of a bad rap. And I don't necessarily always feel that it is as bad or that the prognosis is as bad as it's made out to be. A lot of therapists don't see BPD, and I know other therapists have talked about this in videos too, but it is true. A lot of therapy outlets and a lot of places that do therapy, even like kind of services that are for mild to moderate mental health, will quite often not see patients who are diagnosed with BPD because it is relatively extreme. But I have worked with it quite a bit myself and have found that it is definitely something that can be worked with, and I don't like to see personality disorders seen as something that cannot ever get better or improve, and as something that we should just kind of ignore in the mental health community. So if you have BPD, and if you're one of those people who has kind of asked for a video just kind of summarizing a little bit about what BPD is, and then I will talk briefly about the main type of treatment for BPD, then don't feel like it's hopeless and don't feel like you don't have support. So borderline personality disorder is in the DSM-5, and I am reading from the most recent version of the DSM just to clarify that, because there have been some changes. BPD is a code F63, so that isn't really necessarily relevant unless you work in the mental health field, but in case you were wondering, BPD is generally diagnosed if there's kind of a pervasive, so ongoing pattern of instability in interpersonal relationships, self-image, and it also has to affect impulsivity to an extent. It begins by usually early adulthood, so we do not diagnose BPD in children. There can be kind of tendencies, but we do not diagnose it in anyone under 18. And I would even say like into kind of sometimes the early 20s, you don't want to necessarily have that label being put on someone of BPD. And these symptoms present in kind of a variety of different contexts, so that means they can happen at home, at work, in social settings, wherever it may be. They have to be 5 of the following, and I'm going to read all of the items from the DSM, so there are actually 9 under this particular personality disorder. So there are 9, but you have to meet 5 to be classified as having BPD. Number 1 is a frantic effort to avoid real or imagined abandonment. That means that these people are often really fearing being left or abandoned, whether that be an actual threat or kind of a false threat. They may constantly kind of be worrying about abandonment, and so in relationships they appear very unstable, or like this is something that they're really concerned about quite often. They may be also like that in friendships to some extent, will quite often tolerate things that maybe would not be tolerated by someone who doesn't have BPD in relationships or in friendships or in other kind of situations. This abandonment quite often, I haven't specified, but quite often comes from trauma. So BPD quite often is a result directly of someone having trauma in their lives. Number 2 is a pattern of unstable and intense interpersonal relationships, characterized by alternating between extremes of idealization and devaluation. These are people who will one moment be really talking very highly of someone, like they're the greatest, they're the best, and then very soon after, or even like within a matter of days, hours, whatever it might be, they will really devalue those people and kind of see all of their negative traits. They go from very extreme points of valuing people to devaluing them, and it is quite volatile in that way. Number 3 is identity disturbance. So what that means, I'll read kind of the whole criteria and then I'll explain what that means. So identity disturbance, markedly and persistently unstable self-image or sense of self. So they really don't have the best self-esteem, these people. Again, quite often that's a direct result of trauma or attachment issues from either childhood or early adulthood, or kind of an amalgamation of these things, but they do not feel confident in themselves, or they are very easily kind of brought down in feeling bad about themselves. And this is also where this can be connected to kind of self-harming behaviors, but I'll talk about that in another criteria, because that is criteria 5. Number 4 is impulsivity in at least 2 areas that are potentially self-damaging. The areas listed here are spending, sex, substance abuse, reckless driving, binge eating. Those are just some examples of them, but it can be kind of reckless behavior in any areas, really. People who take kind of extreme risks, which to some extent a lot of people do, but if they kind of fall under other clusters of behavior, that might be a concern of BPD. Number 5 is the one where we talk a bit about self-harm. So recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. This also falls under self-harming and eating disordered behavior. This goes back to kind of that really low self-esteem and the not having a great sense of themselves. And I also think the suicidal behavior, the gestures, the threats are kind of attempts again to build attachments with people. If they feel that people are going to leave them or leave their lives, this seems like a way to keep people around or to deal with those kind of problems and situations. And if you have BPD, you may have some attachment issues. You may have experienced some real trauma or some real issues of someone not giving you love and attention that you maybe needed as a child or as an individual, and this could be leading to some of this kind of unstable behavior, right? Number 6, affective instability due to a marked reactivity of mood. Examples used here are intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. If it was to become more than a few days and it cycled more like that, then it would be more likely that this might be a bipolar episode. But in terms of personality disorder, BPD, it's usually kind of a shorter cycling and it's very intense in how it is experienced. So maybe a person with borderline would be kind of really angry for just a brief amount of time and feel really out of control of that anger. And probably to an extent they really are, because they feel very out of control of their lives. And with trauma, we're really out of control of our nervous system response. We aren't always able to necessarily control those responses, and that's something that we can learn in therapy and we can learn over time. And probably it will never be necessarily perfect, but we can definitely improve how reactive we are to situations. Number 7 is chronic feelings of emptiness. So if you constantly feel empty, this doesn't mean that you have borderline personality disorder. This could mean that you have severe depression, that maybe some things in your life aren't going well. So it doesn't necessarily mean that, but chronic feelings of emptiness are one of the criteria listed. So if that goes along with kind of 4 other behaviors or more than 4, then that is quite a good sign that maybe there are some borderline traits or borderline behaviors that you have. Number 8 is inappropriate intense anger or difficulty controlling anger, e.g., frequent displays of temper, constant anger, recurrent physical fight. Borderline personality disorder people will quite often be in physical altercations. They are quite often angry just all of the time, but then they also find it hard to control like these bursts of temper. So yeah, it's another one to kind of remember. And again, it falls under number 6, which is this instability in mood. You might be really irritable or anxious at certain times as well. Number 9 is transient stress-related paranoid ideation or severe dissociative symptoms. Dissociated symptoms are kind of like when you almost black out from your life, but for a lot of people it's not that extreme. It's like they explain it as watching themselves do things in their body and they just aren't in control, or kind of almost like those third person out of body experiences that people have. You have dissociative symptoms, again, that can be really connected to trauma. It can be connected to attachment issues, and I do talk about PTSD in another video. But this kind of stress-related paranoia as well, like around all of kind of these anxious thoughts, because these are people who have, again, like quite often been through significant issues in relationships and attachments in their lives, and they do live in a very elevated state of stress and anxiety. Those are the 9. Like I say, you have to fall under at least 5 of those criteria to be labeled with this personality disorder. And although a lot of therapists do kind of view it or don't necessarily want to treat it, and I have seen other videos that talk about this too, there are really great resources. DBT is a great resource for personality disorders, and you will find therapists who are comfortable with it, as well as I have recently made an ebook on kind of mindfulness, and I have some DBT resources in there, so those might help with some of those borderline traits as well. Particularly, I created this for anxiety reduction, but I encourage people, if they want to kind of gain control of some of their emotions or their emotional responses, to definitely check that out as well. So if you have further questions about borderline personality disorder and you are hoping to know a bit more, or you want just some information that wasn't covered in this video because it was kind of more the clinical diagnosis, then let me know, comment below. I can definitely make more videos on kind of treatment or living with BPD and just the experiences and the stories that I have heard and my knowledge of the topic. Thanks so much for watching, you guys. Don't forget to check out our website, our social media, and check my links below. Thank you.